Welcome to the Lifestyle Media Group's Lifestyle Live, Beauty, Health, and Wellness from the Inside Out. Thank you for taking the time to listen in. My name is Lori Castle, and I am the Associate Publisher of the Lifestyle Media Group. I'd like to start by thanking everyone for joining us for our panel with Dr. Essie Yates, Dr. Mike Choi, and Carolyn Zaumeyer. A little bit about Lifestyle. Lifestyle Media Group is a monthly publication with a distribution of 127,500. We cover 9 markets that strategically surround the Fort Lauderdale, Miami metro area. We are the largest magazine print company in South Florida. We also offer a full array of digital products from email blasts, native ads, geofencing, geotargeting, and we are very, very competitive. We also have a daily e-newsletter that goes to over 45,000 opt-in subscribers. For all the housekeeping information, we just need you to submit your questions. It will appear in the chat box, and after the interview, we can address those. I'd like to start by introducing our panelists. Our panelists today, let me introduce them to you. Dr. Essie Yates is a female plastic surgeon, board certified by the American Society of Plastic Surgery. She's the owner of the Yates Institute of Plastic Surgery, a beautiful facility steps from Las Olas in East Fort Lauderdale. Trained internationally at esteemed institutions in London, New York, and Chicago. She brings a cutting-edge approach to her areas of specialization, which includes aesthetic, cosmetic, and reconstructive procedures for women. The hallmark of her practice philosophy is reflected in the Yates Institute company mission, outer confidence, inner strength. She has dedicated years of her life training to help rebuild her patients' self-confidence and enable them to look and feel the best version of themselves. Thank you, Dr. Yates. Dr. Michael Choi is a specialist in bariatric surgery. He is the Director of Bariatrics at Broward Health Imperial Point and an examiner for the American Osteopathic Board of Surgery. Dr. Choi understands the benefits of weight loss surgery and is passionate about helping people reach a healthy weight. He is a board-certified surgeon who has performed over 5,000 weight loss procedures since 2006, and he has deep ties to the South Florida community. Welcome, Dr. Choi. Carolyn Zaumeyer is the pioneering nurse practitioner who runs LowTE Florida, providing quality bioidentical hormone therapy based on science, not guesswork. She's the first nurse practitioner in Florida to own and operate an independent practice, the first BioTE pellet provider in Florida, and is ranked #1 in providing hormone therapy in Florida. Carolyn has written 2 books on entrepreneurship, over 30 articles, and has given over 100 presentations at medical and business conferences. She has studied under the nation's most renowned hormone experts, becoming Florida's premier hormone expert. Thank you all for taking the time to join our panel, and now let's jump into some questions. So I'm sure each of you has a specific reason why you got into the field that you're in, and obviously you're also passionate about it. What is your reason? Dr. Choi, what brought you to bariatric surgery?
So it's kind of an interesting question, Lori. So I accidentally got into bariatrics, weight loss surgery, and what I wanted to do was during my education or residency in New York, I felt that I could possibly use another year of my time to get my skills at the most optimal level. So I decided to do a 1-year extra fellowship in laparoscopic surgery, which led into weight loss surgery of gastric bypass, sleeves, bands. And it was just by accident that I had got into going to UC Davis and getting an extra year that it allowed me to flourish into something. And the most important thing about accidentally getting into bariatrics is that the appreciation of the patients with the weight loss, the comorbidities being resolved, coming from hypertension to diabetes, getting their life back, getting their depressions going away, learning how to eat better. So it was an awesome detour in my path in becoming a surgeon, and I'm very happy with the choice that I chose.
Yeah, it sounds really rewarding. Dr. Yates, as a child, did you want to be a plastic surgeon?
Yeah, it was something that had been my ambition from a young age. The reason I love plastic surgery is, because in addition to being a surgeon scientist, like most doctors and certainly surgeons are, you get to be creative, you get to be a problem solver. As you know, Laurie, I have a blended practice. So just like Carolyn, we are an essential business. I do 50% breast cancer reconstruction in my practice, and much of that continued during the shutdown. And the ability to help people, especially in those kinds of circumstances where there is so much in our life that we can't control, so much uncertainty. It's so rewarding, and every surgery is different. No two patients are the same. The anatomy is not consistent. You have to, in the case of a breast cancer, somebody else is doing the first part of the surgery, and you figure out what you need to reconstruct when you walk in the room. There's no textbook. There's no recipe. And that's what I loved about it. And, and I'm actually English, and I did medical school in London, and came to the United States because it's the best training, and plastic surgery was, at the time I was applying, the most competitive specialty in the country. There were 88 spots in the entire United States for the integrated, which is a 6-year plastic surgery training program that I did. And I was lucky enough, especially as a foreigner, to get one of those, and just truly loved it. I trained at the University of Chicago. I've done a lot of breast, a lot of facial aesthetics, and was kind of honored to start my own practice and just continue to help women and optimize their esteem, their confidence, and allow them, as you said in the intro, to be the best version of themselves.
That's great. Carolyn?
There we are. I started right out of school, nurse practitioner school. I worked with a physician, and I shared a desk with him because I was like a little sponge. I felt like I needed to know more and more and more. And so I would do chart reviews just to see his treatment patterns and see what his protocols were, and learn from them. But I noticed a trend with the menopausal women, or even premenopausal women, where he would write in psych referral, psych referral, psych referral. So finally I went to him with this big stack of charts, and I said, listen, all these ladies can't be nuts. And he said, oh yes, they are. They're crying, they're sweaty, they're kicking me, they're miserable, they can't sleep, their relationships are a mess, they need to see a psychiatrist. I'm like, okay, can I have those patients? Oh yes, God bless you. You go take those patients, I'll go deliver babies. Perfect, okay. So I started, and what I was getting was this fabulous feedback. And this is back in the days of synthetic hormones, of Premarin and estrase and all that. And they were feeling so much better. Oh my God, you give me my life back. I like myself better. My partner likes me better. And I'm like, holy cow, this is powerful. And so I really started fine-tuning my prescribing skills and studying and studying. And then in 2002, there was this huge study that just blew my synthetic hormones out of the water. It was a women's health initiative, and most prescribers stopped prescribing hormones at all. And I thought we were going to have a little civil war here with all these women in menopause going off their medication. So that's when I focused in on bioidenticals and went around the country and studied with the nation's greats and really fine-tuned my prescribing, and I'm able to scientifically dose people, which is critical. Or any other method that you use, you have to kind of guess. That's why I would say it's based on science, not guesswork. So for me, that's what got me excited about bioidentical hormone therapy and optimizing thyroid and nutrients and such. So that's how I started.
Very, very interesting. What percentage of your practices are men and women, men versus women? Essie?
My practice is predominantly female. I do have a significant male facial aesthetics following, facelifts, eyelids, and that probably represents about 5 to 10% of my practice, a little bit of liposuction. The remainder of my practice is women, all ages, from teenagers up until older in life, and combination of facial aesthetics, facelifts, eyelids, neck lifts, breast, and then abdominal work, so liposuction and tummy tucks. And then the breast cancer reconstruction is the insurance part of the practice that I do.
Dr. Choi, what's your percentage men and women?
I would say that just recently, it's actually become a little bit better for the men. So I would say in the last 10 years, I say it would be 80 to 20. And now it's like 70 to 30. We are seeing more men out there coming in and concerned about weight loss and then that's where Miss Carolyn comes in, low TE, being obese, not having enough energy, coming in and so they want to change their lifestyles. They want to live for their kids. They want to, see their children grow up, get married, graduation. So it's changed. The parameters have changed for everybody in the practice because everyone's become more health conscious in this time. And obviously through the pandemic, everyone's realized, oh my God, I've got to do something. I have more time. So it's probably a blessing in disguise.
Everybody's had a lot of time at home to think about everything.
Yes, I'm sure.
Carolyn, what's your men-women ratio?
Well, I started out with 100% women with my when I was doing just menopause treatment, and then after I learned the LowTE pellet therapy, more men were coming in. But it was funny when I trained in Texas, the guys were very open about talking about low testosterone. I mean, at the barbecue, at the pool, hey, what's your number? What are you using? Very open. And so I thought, this is fabulous. I'm going to bring this to Florida, and it's going to we're going to rock it. Well, I started talking to men about it here in South Florida, and they were like, oh no, I don't know what my number is, but I'm sure it's just fine. It was like I was insulting their manliness. But over time, my women are bringing their husbands in because the husbands have to keep up with the women. Once I get them ramped up, feeling good, they want to go out. They want, sexual relations are a little bit more fun. And so the men is not like Dr. Choi's is more about 30% now. We started off, with 0, and it just is growing because men are more talking about things. And I've been doing the virtual consultation since I can't be in the office for first patients. And I think I've done already 5 men this week. So it is becoming more common and more understood, where it used to be like, you want to put a pellet where, so now they get it.
How do you think the industry for each of you has changed over the past, say, 10 years? I know there's been so many changes between the consumer and the education and the age range, and procedurally there are changes. Dr. Choi, how have you seen things change?
So as you know, that obesity has become an epidemic in our world. They're saying in the next 5 to 7 years, 50% of Americans will be morbidly obese, which is crazy, meaning that, it's this pandemic, as I keep on saying, is going to help realize a lot of people to understand that, food essentials are very, very expensive. And the cheapest thing is McDonald's, Burger King. You go to Checkers, get a 99-cent hamburger. Because if you go to Whole Foods, the joke is it's called whole check because you blow your whole entire week's savings trying to eat healthy. It's very, very difficult to eat healthy in this time. And now especially, it's going to get worse unless, as I keep on stemming that, there's got to be demand and opening up our economy, because people are just going to get burdened. It's very sad to see all these people waiting in line and trying to get their food, through these food lines. But it's, people don't see it, but it's actually happening. Trending, I think you're going to see more kids and young adults getting weight loss surgery. And then people who didn't think that weight loss surgery was a joke, they're going to start looking more to it, because they are going to have succumb to their comorbidities of hypertension, diabetes, and it's only going to flourish into bigger and worse things if they don't get their obesity under control.
Yeah, understood. Dr. Yates, have you seen things change in your field?
Yeah, well, there has been a lot of self-awareness through social media, through the personal cell phone, selfies. even through this pandemic, I've had an influx of people that came in and said, hey, I need Botox, I need fillers, I need something, because I'm looking at myself on Zoom and I'm thinking that doesn't look good. So, you know, I think that more than ever in history, we are photographing, documenting, we are, you know, using social media, and we are aware of ourselves. So I've seen people coming in a lot for non-surgical procedures. That part of our practice has really grown. People who don't want to take the leap to, you know, or haven't had enough aging or changes, or people who don't look aged at all, but want their lips or their chin or their cheekbones to look different. So that's a really big growing trendy part of our practice, is the non-surgical, because it's easy. You do it in a lunchtime, you can go back to work, minimal downtime, more affordable.
Yeah, for sure. It has really changed though, because I remember back, you know, 20, 25 years ago, you'd see somebody who had a facelift and it looked completely like another person because it was just a big stretch, pull, you know, situation. Now they do so many different things between the fillers and the lasers, and it's a completely, you know, different look.
Absolutely. And good work should not be identified as work at all. You should just look rested, rejuvenated, better somehow. Can't quite put your finger on it. You know, I think the other thing that we're seeing is also people that would just taking care of themselves for more, as Mike is saying, and as Carolyn's saying, people want wellness. That's the reason for this panel discussion is I think there's more emphasis on self-worth and taking care of yourself. And so people that didn't consider themselves a candidate and now researching, learning, they have access to the internet to educate themselves about what we can offer them, and realize that there's so many things like payment plans and other initiatives to make things more reachable and attainable to them.
I also think from my own perspective, everybody, you know, it seems like people are working longer. It's a very competitive world out there. You kind of want to be on top of your game and, you know, not, you know, like aging poorly, trying to, you know, look current. Carolyn, how do you see things changing in the past 10 years with your practice?
Well, what's interesting is I just talking about this last little bit of time is it really has given us a chance to reflect and like, oh my gosh, tomorrow could be my last day. You know, it's like we see kind of the end of the road. And what I've always said with my practice is that we don't know where our end point is. We know, you know, we could live a day, or it could be, you know, 50 more years. But whatever's left in that little section of time, I want it to be fabulous. So I'm thinking that our new normal should be our new fabulous. You know, get your energy up, get your mood up, you get your sleep good, reduce your joint pain, feel happier. Hormones are happy hormones, the testosterone and estrogen. So why not live your best, happiest, healthiest life? Because we found over the research that it's actually healthier to age with hormones versus without. I mean, if you take an apple, leave it on the counter for 3 months, that's like a woman aging without hormones. And I don't want to age that way.
Right, that sounds scary. What a visual. Thank you for that.
No.
Who do each of you think is your ideal client? You know, what does your ideal client look like? Dr. Choi?
Well, due to the progression of what we're talking about in the last 10 years, you know, we went from severity from gastric bypass, you know, to people thinking, oh my God, that is so invasive, going to the lap band, the balloon, and now the gastric sleeve. So at first you would only think that patients would only be coming who are super obese, BMI greater than 40, you know, 50. But now I'm seeing patients who are in the BMI of 30 or less. You know, they've gained 40 or 50 pounds. You know, they used to be 140, 150, had 3 children, and they're like, oh my God, I lost myself. So there is no parameters anymore. As what Carolyn is saying, longevity is so much extended due to technology, through to research and all that's happening in education about how we can better ourselves, our bodies, that there is no limitation. And fortunately, people are just coming in because they just want a quick fix, and they're saying that, oh, I'm going to become one of the losers bench because everyone thinks that it's not, it's not attainable to lose weight on their own, that it's a cheat by having surgery, which it's not, because sometimes, studies have shown that if you do a diet, it's a yo-yo dieting. You'll lose 10 or 15 pounds, and then once you stop dieting, you'll gain those 10, 15 pounds back and another 10. So it's only been showed by the NIH in Atlanta that surgery is the only cure for weight loss surgery and to have complete weight loss. And in addition to that is that the parameters have changed. It's no longer just for the super obese or overweight. It's just someone that just needs a little push or help to attain their weight loss.
I didn't even realize that. That's a good point. Dr. Yates, I know you have part of your practice, which is obviously the breast, reconstruction after cancer, but on the aesthetic and cosmetic side, who is your ideal client?
Well, I don't really have an ideal. I think that I generalize my patient as an ideal patient for my practice if we align in our goals, our visions, that I can meet their expectations. I do a pretty broad spectrum of work, as I mentioned, from facial to body aesthetics, and all varying ages. I think the key is that patients need to be healthy so that surgery is safe. Patients need to be willing to be compliant with the post-op instructions, because there is work and commitment that's required on their end if you're really going to achieve those most fantastic, top results. It's an investment of time and doing the recovery properly, wearing garments, doing massage. There's lots of tips and tricks to get really outstanding results. And so my ideal patient, I just want to know, jives with me, that they don't see surgery as a quick fix. It's a lifestyle. There's a post-op period. There's a commitment required from them to maintain the results that we achieve in the operating room. And, we're really blessed in our community that there are many of those patients around, and many of my patients have truly become my friends in this journey, because it really is a journey. We have a pretty cool concept at our practice of almost like a concierge style relationship with the patients. So they all have the cell phone of my nurses. We call, we text, people are just using Zoom and photos. We've been doing that in a patient privacy conserving way for the entirety of our practice, and we really hold the hands and walk with the patients preoperatively, make sure they get all the correct screening, and then postoperatively to make sure that the result is seamless. So the ideal patient is someone that buys into that philosophy and will enjoy that journey.
Yeah, you have a magnificent office, and I think it's unbelievable that you have your operating room right on the premises. I mean, that really does change a lot, compared to some of the other plastic surgeons.
Yeah, it's been especially a big game changer with what's going on right now, because a lot of people feel like they are interested in having surgery, but the concept of going into a hospital, if it's not essential, is one that is more challenging for them to accept. So being able to offer that in the facility is great. We've had no cases. We screen all of our patients. They're all tested, and with us comes not just me as a board certified plastic surgeon. We're a Quad A, which is a hospital standard freestanding facility. It's the gold standard of certifications. I don't work with one RN in the room. I have 2 RNs. And then of course my anesthesiologist, I work with a board certified anesthesiologist also. So the patients are in good hands. We can control the environment. We can put the safety measures in place in light of the pandemic and otherwise, to ensure that they just have a really private experience when you come in. You're the only patient in the facility the whole day, with all 4 of us focusing on you from the moment you arrive to the moment you leave, which is through the back door for a private exit, so you don't ever have to go through the front and be seen post-surgery.
Thank goodness for that. Carolyn, before we get to, and the panelists, before we get to the questions, I see some of them are coming in now. I think there's a misconception sometimes with hormone replacement and what age that, refers to, because I know, I'm a proud patient of yours, but I know you see people that are 20, 25 years younger than I am.
Yes, it's been, It's been interesting because people's hormones can start to decline, women in their late 20s, and men, their hormones can start to decline in their 30s. So some of my youngest patients are probably in their 30s. And I remember this one lady came in and she had just had a baby and she was 35. And she says, I don't understand what's going on in my body. I have a great husband. I love him. I've got a great home, a kid. Everything is perfect, but I don't have that chemical desire for intimacy. And I said, well, let's test your blood. We do a comprehensive panel. We found out her testosterone was so low she couldn't measure it. And testosterone is inherently responsible for your sexual thoughts and sexual response, satisfaction, and such. And so once I saw that, I was able to correct her testosterone with a little pellet. She came back at her 6-week visit like a rock star. She was so ecstatic. She said, I've got it back. I've got my mojo. I feel like my old self. And that's what I see all throughout the age span. My oldest patient is 88. So there's no cap but feeling good and having your body function the way it should, because we have receptor sites throughout our body for hormones. It's not, we tend to think of it as just sex hormones, but your brain. Testosterone is a brain hormone. It helps rebuild bone to prevent osteoporosis. I mean, there's a lot of good health issues that can be helped or controlled or decreased just by having your hormones optimized as you age. So really across the board, youngest, early 30s, oldest, 88. I can do 100 though.
All right, I'm going to take some of these questions now. We have a question coming in from Steve, and he's asking, would you say that your respective disciplines work hand in hand? And if so, how? What professional advice might you have for each other?
I can start by answering that. And, I was so happy to see Dr. Choi on the board directly because of the answer to this question. He's a very complimentary person to a health and wellness panel, especially one with a plastic surgeon on, because for so many of our patients, surgery starts with optimization. Optimization of weight makes you a healthier person. It gets rid of your comorbidities. It, improves your longevity, but it also is a requirement before you're doing something cosmetic. You've got to take control and stabilize your weight. And so there are instances when patients come to me wanting contouring done of the thighs, the arms, the abdomen, but really what they need is weight loss surgery. I see it a lot in breast reductions also. Women that come in, I've got back pain, I've got neck pain, just saying, I want a reduction. No, you're 300 pounds. This part of your issue is weight. And actually, if you go to a bariatric surgeon first and your weight comes into a more normal range, every procedure I do is 10 times more safe and will have a much longer standing result. So that is one example of where we really work hand in hand frequently for these kinds of patients.
Carolyn?
Well, I think all of it kind of complements each other, because I can get them feeling good from the inside out and help them get motivated to look their best and feel their best. And with that, taking care of yourself, and taking a step back and look at what I'm doing. Am I killing myself with food? And once you have that surgery, there's a whole lot that goes into that. The psychological part of it, the retraining of your brain of how to eat. And once you get that, then you've got it. But a lot of people just feel like it's out of their control and they're kind of giving up. So we give people hope at my practice that yes, you can have a great life. You can make a great life for yourself, but you need to implement changes. Many women say, but I'm doing exactly the same as what I used to do. I said, well, you got to stop the nonsense. Quit doing what you used to do because it's not working for your body today. Your body today isn't the one you had, 20 years ago when you could eat fruit for 2 days and lose 10 pounds. It doesn't work that way. You're 50, it's a whole different ballgame. Trust me, it doesn't get any better with time. So you got to get a grip. The better that you get a grip on it, the better. And once you have that extra skin from the weight loss, then you need to get it trimmed up with Dr. Essie here. And we'll get you feeling good on the inside, because a lot of people with the eating issues have depression, anxiety, sleep disorder, the whole bit. So we were just talking before we came on the air about how we can work together in the future, getting people to be able to live and look their best for the future.
That's all tied in together. This is a question for Dr. Yates. What do you recommend as an aesthetic treat post-COVID to freshen up the skin and to feel younger?
Well, one thing we have been growing in our practice recently is something called PRP. I've done it myself, actually, on my skin. I don't know if you can see, but it's kind
Perfect
of,
from here.
I love it. PRP is kind of, it's a non-surgical technique. It's basically a facial that combines microneedling, which is where you make little channels with tiny little needles in the skin, and then you take the patient's blood, you spin it to get the plasma, and then you apply the plasma onto the face, and it penetrates through the little needle channels, and it causes, evening of the skin tone, rejuvenation, dewiness. It stimulates collagen, especially in combination with other things like fillers and lasers. It really promotes some fantastic rejuvenation in the skin. So that's something that, yeah, people are loving it, and I am too.
Ready. All right, now we have a good one. I like this anonymous attendee. Are any of the panelists offering specials to webinar attendees for the various procedures and treatments that they specialize in?
Well, right now we're running a special in our practice where it's for Botox or fillers. A lot of people are off their schedule, but some people have been impacted economically. So we're offering a $200 discount through the month of May for any person that spends $400 or more on Botox and fillers.
Nice. Carolyn, what about you?
We have, since I've transferred over to doing virtual consultations, we've waived the fee for the consultation. Traditionally, it's been $150 for a new patient to come in and sit down, go over their medical history, what's their list of issues that are, they want to correct, and to see if they're really a candidate for it. So for everybody that's listening, if you want to learn more about it, I have a website that's very robust, LowTEFlorida.com, L-O-W-T as in Tom, E as in Edward, and Florida spelled out.com. You can learn more about it, and on there's also a way to communicate with us. And if you'd like to schedule a free consultation, I'd love to chat with you. I'm lonely here in this house.
Aw, we'll find somebody to keep you company. Dr. Choi, what about you?
We're giving free consultations to all weight loss. Any revision people that have had surgery done at other places, we're not charging anyone that comes in. Our consultations are free. We are offering financing and discounts due to the COVID. I know a lot of people are struggling right now, and we'll see any patients and we'll give any breaks that we can, because I know health-wise is more important than us making monetary gains through any of my colleagues. And in addition to something that I also wanted to tell us is that, people don't understand sometimes weight loss surgery helps out, as we said, the synergistics with Carolyn and Dr. Yates, because they'll start losing weight and then and then they don't feel well because they're hormones, so that we can always send them to Carolyn to get their TE or their estrogen. But a really good concept and idea that I've seen being in the practice is that a lot of patients who are morbidly obese, who are greater than 40, they're like, oh, let me get some liposuction. But when you're 100, when you have a BMI of 40, you're 100 pounds overweight. So a good, reliable plastic surgeon would say, maybe you really should go and get weight loss surgery, because if I do a liposuction, your results are not going to be what you think, and it's not going to be, their patient's not going to be happy, and they're not going to tend to come back to you. So what happens is that once we do a sleeve or any type of weight loss surgery, they lose 70 or 80 pounds, and then Dr. Yates gets the patient plastic-wise, or Miss Carolyn gets it for the hormone. Plastic-wise, it makes it look so much better because it doesn't give the results. And I'm sure Dr. Yates understands, and she's seen that also. In addition to that, when you have weight loss surgery, the breasts kind of deflate. And so a lot of my patients have to go see a plastic surgeon because they don't feel aesthetically, they look a little bit better from the weight loss, but they don't, the full picture is not there. So they want to get their breast auged so that they feel like, that they had really true success.
Yeah, it definitely makes sense. We have a question here from Jen. This is for Dr. Yates. Can the PRP be done on any other areas of the body other than the face?
We have used it only on the face so far, but it's well documented that it can often be used in the neck and chest area. People have done it on the hands for rejuvenation of the backs of the hands. PRP actually historically was used by the athletes. They use them during joint surgeries and tendon surgeries to help rejuvenate collagen and promote wound healing and repair. So the PRP is used routinely throughout the body. It's used in spine surgery. It's used with stem cell therapies, but specifically from an aesthetic perspective, face, chest, and hands is the common sites. In our practice, we have most of our experience with facial PRP.
This is a good one. I know, Carolyn, you're going to love this. I know you've got something really funny in your office that you're going to be able to recite. And the question is from an anonymous attendee. What are some of the signs to be on the lookout as menopause gets closer? All I can think of is there's 7 dwarfs.
Yes. Who were they? Grumpy, sleepy,
Itchy.
Sneezy.
There you go. There you go. Yeah, there's a lot of signs that as your hormones start to decline for both men and women that you may notice. And one is, number one, you may gain weight around the middle that you can't get rid of. You may notice that your mood just isn't the same. You don't feel like you used to. You don't have that energy, that little zip in your step, your mojo. Lower sexual drive, that can be a big indicator. Sleep, disrupted sleep. I mean, if you don't have a good sleep, it's hard to have a good day. And usually when we optimize one's hormones, that's one of the first things they'll notice is they'll tell me that they got a nice, delicious sleep. They wake up feeling more refreshed, feel more like exercising, having sexual relations. So it just really lifts your mood and gets you feeling like you did maybe 10, 15 years ago. Hot flashes, night sweats for both men and women, but hot flashes during the day for women. Joint pain, skin crepiness and dryness. I also correct thyroid, and a lot of the weight can be, people when their thyroid is optimized can have a little slimming down effect. And testosterone, I never promote this as a weight loss program, but once all the wheels get going in the right direction, you give your body what it needs, it works better. It wants to do good. So just
Kind of like you feel better, you look better. It just all plays in together.
Yeah.
Dr. Yates, I almost want to answer this question myself, but since I'm not an MD, I'll skip. At what age should someone start getting preventative treatments like Botox and fillers?
That's not answer. Well, if your name's Dr. Yates, then you started about 10 years ago. But some people might say that's too easy access being the problem. But no, I think that the key is being preventative, right? So starting to try to do non-surgical techniques when you've got a lot of aging in the face usually is ineffective. At that point, you need more aggressive techniques such as surgery. The lovely thing about things like Botox and fillers, not only do they make you look better now, but they, as you can see, prevent you from aging as well. So by staying on top of things, being on a schedule, most people do Botox 3 to 4 months, fillers every year or so, and just doing a little bit. It's like anything else, like eating healthy, doing a little bit each day. In the long term, you don't need a yo-yo diet. It all pays off. So I really think the same, especially for non-surgical things.
Well, I think that has definitely changed over the years. I mean, I don't know what year Botox started becoming so commonplace, but I don't think, I mean, now, girls are doing it in their 20s.
Oh, absolutely. Absolutely. And some of them are really good candidates for it. Some of them really don't need a lot, and we're using tiny, tiny doses, and they say, I want to delay the point where it becomes desperate that I need it. And I want to just keep myself maintained. It's like your hair color. Some of us could be totally gray. We wouldn't know, but we maintained it.
Well, hey, COVID, that did a lot. I've never seen so many unusual hair colors, haircuts.
Hey, half of the blondes I knew disappeared. In 3 months.
It was scary. It was a scary thing. Like all those Madison Reed commercials were clicking in. So I don't know if anybody has any other questions or anything you guys would like to say to each other. I know Dr. Choi and Dr. Yates, you already know each other and have worked together, but Carolyn is new, and we love her at Lifestyle. She writes a wonderful column every month, expert advice, and she truly is an expert in what she does, just like both of you in your professions.
Yeah. Carolyn, I have a question for you. You know, if we were to identify a patient who we think that we've done our best to make them look good, but they're still not feeling good, that there's something missing in the whole holistic well-being, how do we send them to you, and what kinds of things would you assess them for if they did come to visit with you?
Okay, essentially just send them on over, and you know, they can just call and make a consultation. I'll do a virtual consultation with them, but before we can actually see what's going on, we do like a mini physical with our blood panel. We're testing their red blood cells, white blood cells, make sure they're not anemic, have a leukemia infection, anything like that. We're testing their sugar to make sure they're not diabetic or pre-diabetic, their kidney, heart, liver enzymes, just to make sure that they're healthy and there's not something going on there. And I found a lot of stuff with this, you know, people with liver disease that didn't know they had it, diabetics didn't know they were diabetic or pre-diabetic. We also test the thyroid throughout, because the thyroid really helps with your mental clarity, your energy, your metabolism, your heart, your hair, a whole bunch of different things. So if we can optimize that at the same time as we optimize the hormones, we get a far better result. We also check vitamin D because it's critical for your bones, your teeth, your mood, and the latest studies are showing it has protection against certain cancers. And then B12 because it's an energy vitamin. And the number one reason people come in, you would think it was the sex part of it, but it's fatigue. As we age, we lose our energy. And I've got people that are just tired of being tired. And they want to keep up, like Lori said, keeping up with the younger people that are coming into their careers. So they need to keep up. They need to be thinking clearer. And the hormones help lift this like brain fog. And you feel like your mind is functioning quicker and you're on it. It's just a happier way to live. And so that's how we can do it. But we do take that comprehensive blood panel. We analyze that, review it line by line with the patient so they understand what's going on inside their bodies. And then we make we computerized dose it. We put in the patient's age, weight, if they exercise, certain lab values, and certain physical things if they've had hysterectomy, breast cancer, whatever. And our computer program from BioTE Medical populates a starting dose. So we're not guessing. Back in the days of synthetic hormones, we were just starting everybody at the same dose and adjusting up or down if they happen to call back. This gets us 95% of the time spot on with exactly what their body needs for estrogen, testosterone, progesterone, thyroid, and then a bunch of nutraceutical recommendations as well. If their vitamin D is low, it tells you exactly how much to take instead of guessing at the vitamin shop. You know, B12 if that's low, if they're not on probiotics, omega-3s, you know, just to get them to good health, because we want them to age healthier and happier.
Absolutely. We have a couple more questions before we wrap up. And let's see, I don't know who this is best suited for. I'm going to say probably Dr. Choi and Dr. Yates. What are your thoughts on treating teens and young adults? Dr. Choi?
So with teens and young adults, my initial view was I was kind of hesitant because they're not fully adults. They can't really make their own decisions, and I still probably feel the same way. However, if they have a BMI of 40 or greater, which is kind of 100 pounds, I am more open to do the surgery. But the thing is that hospitals are the ones that prevent you from doing it because that's another special degree that you have to have because you're dealing with adolescents. You have to have a pediatric anesthesiologist and you need to have a good team that can handle someone of an adolescent and teenager view. I know it's happening a lot out of the country because the FDA is not only in the United States, so it's having great results for kids who are just some countries, they don't have anything. They can't, and to their religious beliefs, they don't go out, much. They don't go to, they don't go to bars. They don't go to clubbing and stuff like that. So you're going to see kids who are just, their enjoyment is meeting out and having social relationships at a restaurant. And now they're gaining weight. So like in Abu Dhabi and Dubai, the people they have the biggest amount of morbid obesity. But I believe that with adolescents and teenagers, that it's a great thing. I think they'd be advocates. They could get a band or a balloon, and then after that have those, because those are less invasive, because once they grow up and they realize what's happening, they might have a modification change or behavior change. But it really is a case by case procedure, and also in talking to the parents.
Right. Dr. Yates, how do you feel about that?
Well, our society, the American Society of Plastic Surgery, actually provides pretty good guidelines on these topics. So, I mean, essentially for anyone under the age of 18, it requires parental consent for surgery. Obviously, if it's a reconstructive procedure, and one thing that I see a lot come in is girls where the breasts have developed, they're really large, they're really small, they're asymmetrical. If there's a clear deformity and there's a psychosocial impact on the child, like for example, I've had breast reductions in cheerleaders or athletes and people that can't progress in their childhood growth, and the parents and child agree on the plan, then of course we proceed with the parental consent. Of course, that gray area now comes for 18 and above. People for cosmetic procedures, maybe where there's not a clear-cut necessity, and there's a question of the maturity of the patient. And I think that's where, as a doctor, you have to have good bedside manner, you have to evaluate patients case by case, and you have to do ethically what's right. Do what you would do for your child or what you would want somebody else to do for your child. And, in most cases, most patients that come, I've been so impressed. They're educated, they've researched, they have multiple opinions from different doctors. They ask me questions like, are you board certified? And I'm very impressed. In fact, they know what to ask. So I have found that my subgroup of young patients that come in are often asking for appropriate things, are educated and well informed. And if they're not, I don't offer them surgery.
Makes sense. We have a bunch of questions coming in that I think I will probably be able to field to each of you after. We have Dr. Choi, we have a woman named Lori. Her sister's interested in bariatric surgery. We'll have all the contact information for you.
Sure.
And then we have another individual, anonymous, who has had 2 children, Dr. Yates. She's thin and in shape, but some areas are not coming back. Would she make a good candidate for a mommy makeover because she's thin?
Yeah, mommy makeover is an umbrella term. It can mean we do some Botox and fillers for the tiredness in the face from babies, and a breast aug, or a little bit of liposuction, or pinch a little skin out at the C-section scarf, or smooth the tummy. It's not a set procedure. It's a portfolio of options that we tailor make for each patient. So the key in that question is the patient would come in. I don't charge for consultation for cosmetic purposes. We'd evaluate her areas of concern, and I'd tell her what I think can be achieved.
Sounds wonderful. Well, I really enjoyed talking to all of you. I think the panel was great. You had great synergy between all of you and your practices and your ideology. And if you look better, you feel better. If you feel better, you look better. It all works together. Thank you for being part of our Lifestyle Live. And thank you for everybody for joining us today. And have a great holiday weekend.
Thanks, Lauren. Thank you for having us.
Bye-bye.
Thanks, Lori.
Bye, everybody.